The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
It's the second leading cause of death in the United States. Often, it can spread or metastasize, which is the most devastating scenario. Cancer, a disease when detected early, can mean the difference between life and death. On today's show, we'll learn about the activity of cancerous cells, various treatment options, preventative measures, and the possible side effects. Candid discussions from doctors and patients will hopefully lead us to a better understanding of this dreaded disease. Stay tuned for this special edition of Today's Health.
No Halloween blockbuster or nightmarish story has ever frightened people more than a single word: cancer. For those coping with it, cancer can be the challenge of a lifetime. Hello, I'm Faith Daniels, and this is Today's Health. In this special edition, we'll explore how people are living with cancer. These days, cancer isn't necessarily a death warrant, and by understanding the disease, we may be able to survive it and possibly even prevent it.
Every day, millions of Americans are waging a personal war with cancer. Cancer is the second leading cause of death in this nation and will claim as many as 500,000 lives a year. Despite the fact that cancer affects so many people, few actually know much about what it is, how you get it, warning signs, prevention, and treatments.
Cancer is the uncontrolled growth of a tissue. So you've got cells that are dividing and growing, and they grow without limit and replace normal tissue.
When cells divide when they are not needed, they form a mass of excess tissue called a tumor. Tumors can be benign, non-cancerous, or malignant, cancerous. A serious health risk occurs when cells in a malignant tumor invade and damage nearby tissues and organs. Even more severe is when cancer cells break away from a malignant tumor and travel through the bloodstream or the lymphatic system to form new tumors in other parts of the body. This spreading is called metastasis and is the most devastating cancer scenario. Detecting cancer in its early stages can be one of the most vital measures towards full recovery of the patient. Knowing the signs and symptoms can be the difference between life and death.
I first found out I had ovarian cancer on October 8th, 1994. I had been in the mountains. I was in the hospital because they thought I had a parasite. And so all of a sudden I became very bloated and I was hospitalized. They did some tests. The very first inkling that it was even cancer was a gastrologist walked in my room and said my liver was clean. And I thought, oh my God, they're looking for cancer.
The signs to look for ovarian cancer would be abdominal bloating, abdominal pains, irregular periods, alternating bowel habits, constipation, diarrhea. It can present in such a bizarre number of ways that almost anything could be construed to be ovarian cancer. I guess the take-home message for physicians is that if a patient has persistent abdominal pain and it's lasting a week, 2 weeks, a month, ovarian cancer is something you have to start thinking about.
Skin cancer is unique. It's the one cancer we know what causes it, and that's ultraviolet rays from the sun. If you add up all the other kinds of cancer, lung cancer, colon cancer, breast cancer, the number of those other cancers does not equal the number of skin cancers. There are 3 kinds of common skin cancers. The most common is called basal cell carcinoma, and that usually happens where the sun shines, which is going to be your face and your nose particularly. The second kind of skin cancer is called squamous cell carcinoma, also caused by the sun, and also tends to occur where the sun shines, which is going to be your face and the back of your hands. The third kind of skin cancer is melanoma. It's fortunately the rarest, but it's the deadly one that we're afraid of. It's caused by the sun, but interestingly, it can happen anywhere on your body, behind your ears, between your toes, anywhere. Skin cancer is very easy for us to screen for and detect, And the way we do it is with a trained eye. If a lesion looks suspicious to a trained eye, a biopsy is taken and it's examined under the microscope. For people at home, what you'd be looking for is something that's growing and changing. And the thing to remember about skin cancers is they don't go away by themselves, they don't get smaller by themselves, they get bigger.
I didn't know it was skin cancer at first. It was a sebaceous growth here, like a ball, and everybody thought, oh, that's fat. But we went to take it out at the dermatology department, and they did take it out. And also, at that moment, my wife explained to them that my son Philip, who died several years ago, had melanoma. So after hearing that, they started looking for my skin in my back, in my arms, aside from this growth here. And they found a melanoma cancer here. So I'm very concerned in telling my other children to watch for skin cancer themselves, because there is a predisposition there that we have in our family.
I first discovered I had lung cancer in approximately June or July of '94. Well, of course, I was very upset. Everything I had heard about lung cancer and the few people that I knew that had lung cancer hadn't lived too many years after the diagnosis. So I felt like this is it. My life is just going to be over.
A person who's, say, over the age of 40 or 45, especially if they're a smoker, if they have a persistent cough or they cough of blood, if they have pneumonia that is persistent or recurrent, or an unexplained chest pain or unexplained blood clots, should see their physicians right away, have a chest x-ray immediately, and even if the chest x-ray is not suspicious for cancer, if the symptoms do not go away in a few weeks, insist on getting a CAT scan of their chest.
I was a very heavy smoker. For many years, I was smoking over 3 packs a day. I understand that the first cancer that I had is the least associated with smoking. The second one that I had, which is small cell lung cancer, is the most associated with smoking.
Early detection and prevention are key in reducing death, but making healthy changes in your lifestyle can greatly reduce the risks. Avoid smoking, as it is the #1 cause of lung and cervical cancer. Eat low-fat foods and limit salt-cured, smoked, and barbecue meats. If you are exposed to the sun between the hours of 11 a.m. and 3 p.m., wear a shirt and apply sunscreen to help minimize risk during these times. Preventative measures can greatly reduce the risk of cancer, but cancer can strike anyone.
Being diagnosed with cancer is usually an emotional experience.
I try every day to find a reason to go on.
We'll take a look at the 3 main treatment options and their effectiveness against certain types of cancer. Coming up.
So many misconceptions are associated with the term cancer that some people are actually too frightened to go see a doctor. It's unfortunate because early detection and current treatments are the keys to survival and in many cases a cure.
Having cancer doesn't mean you can't enjoy life. Knowing the facts and facing them can take away much of the fear. If your cancer cannot be cured, treatment may control it for months or even years. There are many tests that may be used to find out what type of cancer a person has, where it is located, and whether it is spread. This may often take time, but it is essential that an accurate diagnosis is made so the most appropriate treatment can be prescribed for maximum recovery.
There are a number of tests that we use to diagnose prostate cancer. The 2 commonest tests are the digital rectal exam and the PSA blood test. The digital rectal exam entails the gloved finger entering the rectum and feeling the prostate. The PSA blood test is done by drawing a sample of blood and then examining it chemically.
The best way of detecting breast cancer at an early stage is self-examination. The actual test that is commonly used for the detection of breast cancer is mammography, which is an X-ray of the breasts. And we can actually detect very early and small lesions of the breast, as little as less than 1 centimeter. That test should be done routinely in all women older than 40 years of age.
We're going to do your pelvic exam now.
Cancer of the cervix is not as common in the United States as it is in other countries. The primary reason is because the pap smear is capable of detecting precancerous lesions or very early cancer, so they can be treated appropriately at a very early stage.
Today, medical technology has developed many treatments that can control, even eliminate the cancer. There are 3 main methods that can be used alone or in combination.
I would divide the treatment for cancer into 3 broad groups of types of treatments: surgery, radiation therapy, and chemotherapy.
Surgery is one method that removes cancer cells or tumors from the body. Many times, surgery is accompanied with radiation or chemotherapy to ensure that all the cancer tissue is destroyed. Radiation therapy involves the use of radiation to destroy the cancer cells in a localized area. It deposits energy in the area that's being treated, which injures or destroys the cells that are located there by damaging their genetic material, making it impossible for them to continue to grow. Chemotherapy is the use of many different types of drugs to destroy cancer cells throughout the body, keep it from spreading, slow the cancer's growth, and relieve the symptoms caused by the cancer. Chemotherapy is often given in on and off cycles, including rest periods, so that your body has a chance to build healthy new cells and regain its strength. However, serious side effects can sometimes severely hamper even the best of treatments. Side effects from radiation and chemotherapy depend largely on how much and where the radiation is administered, or the type of drugs that are used. Side effects can range from nausea and vomiting to fatigue and hair loss. The reason for this is that these treatments harm normal cells as well as cancer cells. Even though many of these side effects are short-term, they can be so severe that the patient finds it hard to live a normal life during this time.
I did have side effects, some serious and some not so serious. I lost my hair. The nausea and throwing up was a big side effect, and it was constant.
The side effects I had was nauseousness and diarrhea. And when I had my psychotherapy work done, I was trained to look at it as if it was cancer. So it might sound weird to some people, but I actually looked at everything. It was, if I vomited, I looked at it and I thought, this is good, this is positive, the cancer is coming out.
My greatest fear when I found out I had prostate cancer was, oh God, there goes my sex life. And, you know, being a normal man, I didn't want to lose my sex life.
One of the other side effects from my chemo was that I was going to lose my hair. The first chemo was the most aggressive. They had suggested I had like medium length hair. They told me to cut it very short. And I looking back, I think that's the correct way to go, because it's you know, it's hard to look at your hair fall out, and when it's only an inch long, it's not that bad.
My doctor discussed every side effect that I could possibly have, and he said one of the most devastating that most people find is the loss of hair. And he really put that in perspective for me by saying I should concentrate on the best side effect, which would be that I'm going to get rid of my cancer. And you realize that even though it is devastating when your hair falls in clumps and you have to cut it or shave it off the rest of the way, you're going to be well and you'll get your hair back.
If you don't prevent the nausea and vomiting, the patients can go on to develop a syndrome we called anticipatory nausea and vomiting. And what that means is the sensation of coming into the office, the smells that the patients perceive, seeing the chemotherapy administration room, just evokes such strong reflexes in the patient that they get nauseated before they've even gotten any chemotherapy.
Fortunately, we have very good medications now for the prevention of nausea and vomiting. So nausea and vomiting now have become much less important than they used to be in the past. Hair loss, unfortunately, remains a major problem for all patients.
I try every day to find a reason to go on. I have to admit, sometimes I didn't want to. But then I have my husband, and he always seemed to find the right words to tell me to go on to the next chemo. Or there's signs. Every day there's something that comes into my life, and it tells me that I need to go on, not to give up.
Coming up.
If you look globally, approximately 50% of all cancers are currently cured.
Although there are promising new treatments that are giving cancer patients more hope, early screening procedures are still the best way to stay one step ahead of this terrible disease. Next on Today's Health.
When people hear the diagnosis cancer, they may feel like they're facing a future of uncertainty. Just what are the challenges they'll face, and what are the treatments in development that will give them hope?
A number of promising new treatments for cancer are on the horizon. The future looks bright in terms of finding a way to eliminate this horrible disease. But people must not overlook the importance of detecting cancer early on. Catching it in its early stages is still the best way to overcome this potentially terminal illness.
I think that in the past few years, cancer has literally come out of the closet, whereas before, most people tried to not detect cancer, tried to avoid talking about it. They're talking about it more and more often. I think that is caused by the fact that there are many more hopes now than there used to be in the past. The area of immune therapy is likely to become more and more important. We have a new antibody against breast cancer called HER2/neu that seems to be quite effective. We have antibodies in lymphoma that are quite useful in special settings. And finally, knowledge in genetics increases. We might be able to deal with genetic abnormalities, which will be a completely different way of treating cancer. If you look globally, approximately 50% of all cancers are currently cured. If you look at selective cancers, such as acute leukemia of children, approximately 80% of the children are cured. If you look at cancer of the testis in men, approximately 80 to 90% of men are cured.
Advice that I would give to others is be sure and have your PSA checked often, because it's by knowing that the PSA is rising that you determine that you do have an increased growth in your prostate gland.
I would like to say to the young people, I was young once myself, and of course we all tend to think we're invincible, that we're immortal, and we are not. If I could stop smoking, and I was smoking 3.5 packs a day at the time that I stopped, anybody could stop smoking.
Positive attitude definitely is going to get you there. Is going to get you through this.
As soon as you suspect that some growth might be cancerous, have a doctor look at it for early detection. Early detection is paramount for skin cancer, in my opinion.
I would advise others who have been diagnosed with breast cancer as quickly as they can to get professional, competent help, even if it means going out of their area. And I would hope that they have a good support group of family and friends. That's almost as important as the professional treatment that you get.
I found that, much to my surprise, when my wife got ill, I knew how much I cared for her, but this made me aware of how important she is to me in my life.
Dealing with cancer and the effects of its treatment is a physically and emotionally taxing experience for both the patient and the family. It's important to be educated about the disease, treatment options, and side effects, as well as to know what measures can be taken to alleviate any unnecessary discomfort during the recovery process. Today, many people are dealing with cancer. They're recovering from it, and they're living long, productive lives.
When I think about the future, I vacillate. Sometimes I think I'm going to beat it. Other times I feel I won't, but I'm hoping for enough time to do some of the things. First of all, my grandson will be bar mitzvahed in 3 years, and I've told my doctor that I want him to make sure that I'm around for the bar mitzvah.
I'm determined to beat anything. I've had a team attitude all my life and a sports attitude, and naturally I always want to win. So I certainly want to win the cancer battle.
You know, I'm 74, and you know, people have to die of something and sometime. So I have lived a wonderful life with a wonderful family, and you know, it has to end someday.
I believe that you could do it, even if you didn't have the support group that I have with my family. If you are alone, you can do it. You have to set your mind with it and let the doctors worry about the medical end. You just concentrate on that you're going to do the best thing you can, and you're going to stay strong. You're going to have down days, but they come right back. I mean, you bounce right back. I mean, I'm living proof of it.
You'll be amazed at how much information there is on the internet concerning your health and well-being. For a good start, visit our Today's Health website at vstar.com. When it comes to cancer, we've taken great strides, but we still have far to go. Every day, more people are surviving, and survival is really the greatest victory until there's a cure. I'm Faith Daniels. Join us again next time as we get right to the heart of matters concerning your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.